Sure.
We do appreciate keeping the mic closed.
لا
to
عندي
avoid any
مبسوط
background noise. Okay, welcome everyone. Welcome year 1 and year 2. Today we have a very interesting session, which is online teaching and learning tools, teaching tools and learning tools. Today, I'm honored to be with you with Prof. Hani Wahib. Hani Wahib is professor of anatomy in Ain Shams University. He is we do appreciate keeping the mic closed to avoid the background noise. Thank you. I co-facilitate this session with Prof. Hani Wahib, professor of anatomy in Ain Shams University, and also FAMER faculty and FAMER fellow since 2019. And he also was the vice dean for student affairs in Delta University. And I'm also going to be with you in this session. Dr. Hani, would you like to say something before we start the session?
I like to say welcome to everyone. This is a very interesting sessions, interesting topics chosen by you. Within 10 minutes, every fellow will present an innovative idea and then get the feedback. Welcome everyone and enjoy this amazing session. Thank you, Professor.
Thank you. Thank you. It's my honor to be with you today. Today, simply, we are going to explore the latest tools and techniques for effective online teaching and learning in medical education. We are going to discover innovative approaches to engage students and enhance the virtual classroom. The objectives for this session is simply that we were aiming to have and to deepen the network and the community of practice between the two batches through peer sharing, where year 2 are going to present and share their expertise in online teaching, learning tools with year 1 fellows. And then year 2 are going to lead the engaging online session to show their skills. Finally, we are going to have an interactive discussion between year 1 and year 2 about what they have seen and what they would like to inquire about. The session design was simply that year 2 had actually presented their own ideas through a Google form, where year 1 chose the most innovative ideas from their point of view, and based on the polls, we chose the highest voted topics. And the highest voted topics were Dua Nassar, telehealth, bridging gaps in medicine and medical education and healthcare. Ahmed Waili presenting using Canva to create simple infograph for e-learning. Ola Izzat is going to present smart teaching, fun learning using Edpuzzle and gamification tool in medical education. And finally, Mohammed Hassan from Zoom Fatigue to Zoom Fluency, practical tips for interactive live sessions. What's going to happen right now is that we are going to start with our colleagues. Each colleague have 15 minutes to present his or her presentation by this order, and then we are going to have 5 minutes for discussion. We are going to put that on the timer, and we appreciate sticking to the time in order to have a very fruitful group discussion by the end of the session. Stay tuned, post your questions in the chat in order to be prepared when we have the discussion period, okay? Now we are going to start with our first colleague, Dua Nassar, and telehealth, bridging gaps in medical education and healthcare. Dua, the floor is yours.
Good evening, everyone.
Good evening, Dua. Share your screen, please.
Yes, okay. I viewed now, right?
Crystal clear.
Yes.
Okay. Telehealth, bridging gaps in medical education and healthcare. I am Dua Nassar, lecturer of medical parasitology, Faculty of Medicine, Ain Shams University. Today, I will talk about definition of telehealth, overview of telehealth tools in medical education and healthcare, benefits of telehealth and the challenges faced in implementing telehealth. What is telehealth? It's the provision of health services by health professionals, where distance is a critical factor, using information and communication technologies to exchange valid information for diagnosis, treatment, prevention of disease, and to facilitate the continuing education of health professionals. What is the difference between telehealth and telemedicine? Telehealth is a broader term. It includes both non-clinical and clinical services, such as virtual education, training of medical professionals, and public health functions. Telemedicine is specific to remote clinical services. So, all telemedicine is telehealth, but all telehealth is not telemedicine. Now, please scan the codes and submit your answers about what do you think the telehealth tools used in health, medical education and healthcare. Please scan the code. I will put the link in the chat box. You see the Mentimeter on the screen?
No.
Yes, Dr. Dua.
Okay, Dr. Hani, it appears on the screen or what?
Yes, it appears.
Okay.
Appears for me. Yeah.
So we have some answers. Distant learning, Zoom meetings, online sessions and classes, learning management system, Zoom meets, LMS, virtual lectures, Zoom. Okay, that's great. Okay. We can come back. Okay. So what is the tools of telehealth? There are conferencing platforms.
Dua, you need to swap to the presentation
Okay.
view.
Okay, sorry.
Never mind.
Okay, now?
Yep.
Okay. Teleconferencing platforms, virtual learning environments, simulation and virtual reality-based training, digital examination tools, mobile application, and AI-powered tools. So most of you get it right. First, teleconferencing platforms like Zoom and Microsoft Teams for live lectures, for interactive question and answer sessions and group discussions. Virtual learning environments like Moodle and Blackboard Learn for online course materials, discussion forums, and assignment submissions. Simulation and virtual reality-based training like Body Interact. It's a screen-based simulation accessible on desktop or tablet with no headsets needed, and that's the main difference between simulation and virtual reality-based training. The users manage to visual patients on screen with real-time vital signs. This allows students to diagnose and treat virtual patients. It enhances decision-making skills, clinical reasoning, real-time feedback, and allow practice and managing treatment plans in a virtual space without risk to real patients. Virtual reality-based immersive simulation like SimX is a computer-generated environment with scenes and objects that appear to be real, making the user feel they are immersed in their surroundings using headsets. These allow users to interact in 3D virtual environment, like in emergency scenarios or surgical procedures, and to virtually walk through the human body in anatomy exploration. This is an example.
Human Anatomy VR delivers the most immersive human anatomical experience available for medical students, professionals, and institutions. Feature-rich content is delivered in a deeply engaging experience with excellent graphics and innovative virtual reality presentation. Thanks to the hand tracking innovation, there is no need for controllers anymore. You can use your hands to reach any structure you are interested in.
Also, we have digital examination tools. It's an electronic devices and software used to conduct medical examination remotely or an educational setting, like electronic stethoscopes to remote auscultation and record heart and lung sounds for later analysis or educational purposes, and digital otoscopes, remote ear examination and record videos for educational demonstrations. Mobile applications like UpToDate and Metascape allow access to medical information, Teach Me Anatomy, and collaboration tools like Telegram and WhatsApp for quick information exchange. A very important tool is the AI-powered tools. There are many healthcare chatbots nowadays for symptom checker or mental health support for patient engagement. I choose ADA Health. It's a medical AI chatbot that help users identify possible health conditions based on the symptoms they input. It's available via mobile application and web platform to provide health assessment report that can be shared with a doctor, and for educational use, it simulates patient interaction for medical trainees and provide instant feedback for differential diagnosis. For sure, it's not a replacement for clinical judgment. It's best used as a supplementary tool. Also, Babylon Health's digital healthcare platform, it's a global digital platform that blends AI technology with telemedicine to deliver accessible, efficient, and personalized healthcare. It's an AI symptom checker. It offers teleconsultation, 24/7 virtual visit with licensed doctors via mobile app or application or web platform. It directly issue prescriptions and referrals and track chronic conditions, and digital health records secure and centralized for easy access. It reduces ER visits and waiting times. It also increases access in underserved areas. Benefits of telehealth tools are enhanced learning experience. It gives real-time feedback and the ability to record and review sessions for study and improvement. Of course, it enhances collaborative learning, so students can engage with peers and instructors across various geographical locations. It improves accessibility. It access to quality education for students in remote location. It enables broader range of patient interaction and case studies. It reduces the need for patient and student travel, and it offers more flexible schedules for educational and diagnostic sessions. Challenges are, of course, cost of implementation and sustainability, resource availability, technical issues, faculty training, and limited hands-on training in virtual education and privacy concerns. Remember, human interaction and hands-on experience remain crucial aspects of medical education and healthcare. So these tools should be used as supplements, not replacement for traditional teaching methods and clinical decisions. Thank you.
Thank you so much. Thank you so
Thank
much,
you.
Dora.
Thank you. Amazing, Dora.
Thank you, Doctor.
Well done. Now, anyone would like to ask Dua any question? You may raise your hand or post your question in the chat. Okay, Dua, let me ask you, did you use or utilize any of these tools in your practice, taking in consideration that you are a parasitology or from the parasitology department? Did you have the chance or the opportunity to work with any one of these tools?
Of course, of course, Zoom, Telegram, Moodle, all of these we use daily in our educational system. Okay, but I was fascinated by the applications, AI power tools. It's very nice and very helpful actually. But of course, I didn't use it before. I hope we can use it in Egypt, actually.
Thank you so much. We have two raised hands. Let's take Bassam and then Minatullah.
Assalamu alaikum. Thank you, Dua, for interesting topic. I like the point where you've been realistic on the expectation. There are some hands-on, and this one there is no surrogate or alternative for, but a lot of other topics, which is a kind of theory or simulation parts or discussion interactive. I think this could be suitable for the innovative tool, but for the hands-on, we are saving time and saving costs for the hands-on. For example, we don't have to have the place and venue and person all the time available for the face-to-face. For example, we can reduce the amount of face-to-face education maybe to the third when you utilize these tools. Thank you.
Thank you, Dr. Beth.
Thank you, Dr.
Dr.
Bassam.
Dr. Bassam, the background behind you is amazing.
Oh, thank you.
You are in London.
I'm in Dublin.
Oh, no, okay.
Yeah.
Okay, let's go to Minatullah.
Thank you so much, Dr. Dua, for this session. I was wondering if there's like a platform or if these platforms that you mentioned work for pediatric patients as well. If there's like a symptom, a rash or anything, can we upload photographs, anything like this, if you have an idea?
I don't have an idea, but I think any application, if it works for any disease, it can work for pediatric patients. But I don't have an idea for specifically for pediatric patients.
Okay. Thank you so much.
Thank you, Minna.
Dr. Iman Helmi
Doctor,
post a questions. Dr. Iman,
can
you could post your question.
okay, can we take only Dr. Gamal because he's raising hand and then take the
Okay.
questions in the chat?
Okay,
Dr.
thank you, Dr. Dua.
Thank you, Dr. Gamal.
Excellent presentation. I ask about patient management system, BMS. It is like LMS, Learning Management System. Is it considered a tool of telehealth?
I think yes, telehealth has an tele-education, telemedicine, and patient portals, يعني, and many subcategories under telehealth, and I think patient management system is one of them. Yes. And Dr. Hani
Because
can be more.
yes,
Yes, we have.
I think presentation is not included it, so I missed it.
Dr. Gamal and Shams, we have a virtual hospital in collaboration with St. Mary in London, I think. And one of the tools used is the patient management system to serve in Africa, also in Egypt. I have a comment, Dr. Nago, after Dr. Iman and after all the raised hands. I think you all enjoyed the presentation of Dr. Dua.
Thank you, Doctor. Dr. Iman asked if these tools could be applicable for different medical specialties or there are restrictions in some specialties. I think it can, يعني, medical clinical specialties, I think it can be applied. But I don't have this enough experience to يعني,
Thank you.
to be more specific. Yeah.
Okay,
Dr. Dina, you could comment.
Okay. Thank you for the great presentation. Actually, I would like to say that telehealth now is the future and digital health. For what we say that we have always a ratio of poor ratio between healthcare provider and our patients. For example, not only for medical education, but also for providing services. So in many African countries, they use these digital health tools for this to provide services like antenatal care, recognizing early symptoms for any problems, and so on. So in Egypt, we have a specific experience that I'd like to share one. It was a few years ago, and it was with the Ministry of Health and in collaboration with the WHO and the Ministry of Communication. We had what we called the mHealth initiative in Egypt, where we used to send like messages for diabetes patients regarding their nutrition, their care, their screening, and so on. And we had also another example of this mHealth. It's a very يعني طبعا basic model of telehealth because it's not interactive, it's one-way messages that was also done with MTB, tobacco cessation. So it is always proved to be very beneficial, very well received by our population. And I think it is going to be the future for many specialties. And thank you for this presentation. Thank you.
Thank you, Dr. Dina.
Dr. Nagwa, could I share my comment?
Yes, yes, sure. The floor is yours.
Thank you, Dr. Dua. This presentation is amazing presentations. You follow the same school. I was following several years ago. When I make a presentations, I provide several applications to be used and to be tried after the presentation is finished. Multiple useful tools, and many of the fellows ask for the presentations and the PowerPoint. Personally, I will try the ADA applications. I liked this applications when you present it. Thank you, Dua.
Thank you, Dr. Hani. Thank you.
Thank you so much for all the comments and all the questions. What I would like to add is that actually telemedicine, telehealth is part, as Dr. Dina said, of the future, and it's part of Egypt Vision 2030, and it's part of the healthcare. And now it has been approved in many of the sectors, especially those with the universal health coverage, where we have the telemedicine. And there is a conference, video conference, and there is a specific application. And the video conference where specified specialization and specific dedicated time of the day are transferred via the PHC center to the ministry or to the specialized tertiary hospital according to the protocols that had been implemented. And in different places also, the tertiary hospital has a specific clinic where it can do for the secondary hospitals and for specified clinics that has a consultation without having the patient to be visiting another place. So it's the future because it's part of the future right now, and we have to implement and go with. Thank you so much, Dr. Dua, and thank you for all the points that have been addressed so far. And let's move to our second presentation with Ahmed Gwaili using Canva to create simple infographics for e-learning.
Thank you, Dr. Nagwa, for that. Can I start sharing my screen now?
Yep, sure. The floor is yours.
Hello, everyone. My name is Ahmed Gwaili, and today we are going to present a short session on how we can use Canva, but still do powerful infographics. 1 second. Oops. Just having a small technical issue here. I'm sorry. Okay. So our objective today will be to understand the importance of infographics in e-learning in general and the medical e-learning in focus. Learn key design principles for creating effective medical infographics and explore the advanced tips to enhance the infographic impact. And we will have a short practical session on the Canva website itself. So let's start by understanding what are the infographics. Infographics are visual tools that help to explain the complex ideas and make it clear in an engaging way. In medical education, we deal with a lot of complex and detailed contents. The infographics can help to break it down using visuals like icons, charts, or even short text. The infographics can also make learning easier and improve how people understand and remember the information, and it can be understood by many types of learners, ranging from students to the patients. To make a good infographic, we need a focus on 3 key elements. We use simple language and try our best to avoid too much text within the infographic, and also to use the proper size and the color and the layout to guide the eyes of the viewers. And everything you show must be accurate and come from trusted sources. When you are designing your infographic, here are a few design basics to keep in mind. Try your best to choose a color scheme that match your topic. For example, the green often represents health, and the red color points towards a warning sign. Use clear and readable fonts and avoid anything that looks too decorative. Use the same colors and the styles throughout your infographic design to avoid any confusion. And don't forget about accessibility by using good contrast and write in plain language so everyone can understand it. And the most important question here, why to use Canva? Canva is actually a web-based design tool that is easy to use, even if you don't have any graphic design experience. It has many built-in templates and icons and illustrations, including medically related ones. You can make high-quality visuals very quickly and very easily, and also it allows you to share your design with others so team members can work together on the same project. And here is simple step-by-step way to make an infographic in Canva. Start by defining your main message and ask yourself a question. What do you want the learners to understand? Then collect your data and check that it is correct. Make a rough layout or sketch of what you want to show, and choose a ready-made template in Canva that fits your topics. And finally, customize it. You can add your content, icons, images, charts, anything that is related to your infographic or topic can be added to it. And for more advanced users, Canva also allows you to show complex process with diagrams or flowcharts, and it also can explain step-by-step procedures using the timelines as shown here, and it can add you can add your institution logo or colors, and those small touches can make your infographic more professional and align more with your institution theme. And now let me stop sharing this screen and we will move shortly to the Canva website itself. So as you can see here, sorry. Just another technical problem. So let's move to the practical part of using Canva website here. First of all, you need to create an account and login from here. And Canva offers many features for free. For more advanced tools, you will need a paid subscription, but believe me, the free version is excellent and it provides a lot of useful information. To start, we need to sign up and sign in here. And as you can see that Canva gives you so many options to create many types of content, ranging from websites, videos, social media posts even, and the most important topic that we are going to discuss here is the infographics. Once we click here, it starts with a blank page and hundreds, if not thousands, of templates that you can use, which is ready to use here. You can initially use the templates and change it to match your needs in the topic or the project that you are preparing, or when you become more experienced, you can use the templates as inspiration to create your own infographic. But let's start with one of the templates here. This looks fine. So here I can edit any item that you can see in the infographic. For example, I can add any of the elements here, ranging from photos, videos, audios, charts, or you can edit it, the text or the heading or the writing style or the colors from here. You can even upload your own resources, your own image or charts to use it in the infographic again. Like, for example, I can use this to create a timeline for our ML Web project design. Let's start with evidence in healthcare. And I can increase or decrease the size from here, change the font, the color, add some animation. Second control A, let's any of the items can be changed. This can be changed and swapped with anything else from the elements that we have here. Numbers, orders can be arranged. Data here can be edited. And in few minutes, you can end up having your roadmap, for example, to your project in just a few minutes, which will look very professional. This was a very quick presentation. Let's move to another, maybe very important thing I would like to share with you as well, which would be the video infographic. If you go back to the home screen and just search for video infographics, you can see that you have hundreds, if not thousands, 20,000 video here that is ready to use and adjust based on your needs. You can use any of them to create, let's say, a short video presentation or introduction to your project team. I have used this one before, so let's go through it. Here you have 4 slides, but you can still add as many pages as you need here. Any item here can be changed or adjusted. Let me add the names of my team, Dr. Rada. On the next slide, again, this video can be changed, removed, and the picture of the person or another video can be used here. Dr. Dua. And for the next, I would use the name of Dr. Gamal. And for the final slide, let's use the name of Dr. Amal. Sorry for that. And the final result will look like that. Again, the results look very professional, although it only took me a few minutes, if not seconds, to create it. And after you are done, either you can share it from here. Oh, and you, as we said, like you can add more people to work on the same project that you have. So again, more than one team member can work on the same project on the same page, and then you can download it from here. Let me go back to the PDF presentation. We have the technical issues that we have here. And this brings us to the end of this presentation, and thank you for your attention. I hope that this gave you a good starting point about using Canva, and I will be more than happy to answer any questions if you have. And again, thank you all.
Are you sure you are ready for the questions?
Let me
You
bring the
sure?
previous slide again.
No question, no question. Perfect.
If you dare, you can ask.
Okay, we have plenty of raised hands. Let's start. Dr. Bassem.
I hope that I'm ready for the questions, actually.
Assalamu alaikum.
Alaikum salam.
Ahmed, thank you for the interesting presentation. Like, I envy you for choosing Canva. I like it. It's a treasure. I have a couple of questions. So first of all, how long it took you to familiarize yourself with it? Do you think I like it? I used it before for designing certificates, designing presentations, and I see how user-friendly it is working with the layers and the preset templates. But I'm asking you, average, do you think it's time-consuming to train yourself on all the tips and tricks? This one thing. The other thing is about the subscription. I'm not sure. Do we need to have a university or institute to get us a paid prescription, because there is a lot of limitation on the free one? I'm asking about practical point here. Thank you.
Thank you, Bassem.
That's
And I
a
was
true and
expecting you
valid
to ask any
question.
question.
That's
Can I
true
go
and
for
valid.
the
Yeah,
Yes.
because Dr. Ahmed, there is, when you said you can co-work with your colleague in the infographic, that needs a subscription.
Only one subscription. So if I have a paid subscription, I can add as many team members as I have. Yes, this is a very unique option for the paid subscription. Okay, but again, if you start at if you talk about a beginner level, the free option of Canva is more than enough. And to know what to do on Canva, it may take you like 20 to 30 minutes to understand how it works. And the website itself has like 2 or 3 tutorial videos. Each one of them is 4 or 5 minutes, which will show you what to do. And all what you need is just the intention to start. For me to get more and more experience with the Canva, it took me like 2 or 3 hours on the website until I could generate similar videos to this. And it wasn't really difficult. Okay? And the result, like if I work on, let's compare it with the graphic programs, the advanced ones that we initially, like 2 or 3 years ago, we used to have it or needed to generate such results. Those programs needed at least a week of training until you get a very basic design. But here with Canva or whatever the website which can produce similar results, I'm not just saying that Canva is the only one that can use it here. I'm just using Canva as an introduction to this era. With Canva, 30 minutes to 1 hour is more than enough to understand how it works and get a reliable result.
Unless Femur will provide us with paid prescription. And have you tried Napkin AI, Ahmed? Napkin, I think it will provide you with infograph as well.
Yes, I've tried it, but I don't know why, but maybe because I started with Canva, so I liked Canva more. But is it equivalent to Canva? Yes, I have to say.
Thank you, Dr. Bassem. And let's go to Dr. Gamal.
Thank you, Dr. Ahmed, for presentation and pointing to our teams in your presentation. Really, I used Canva 2 years ago, and it is very easy and simple. And I feel I am a professional designer with using Canva. And I started to use it with education for my student, asking them for a project or a poster design or infograph. My question is, I really find it difficult to explain what is the difference between poster and infograph. I asked this question from many students, and I feel it is difficult to explain to my students. Is there a difference between poster and infograph as a term, or they are the same? What do you mean? What do you think about
First
that?
of all, thank you, Dr. Gabor, for this question. Actually, I had on my presentation a slide to show the difference between poster and infographic, but because I found it very difficult to explain it, so I just deleted it. From my own understanding and
I
from my
escape
research,
from the
I
question.
yes, exactly, because it's not an easy question. From my own understanding, from my own research, what I understood that in the poster, it doesn't have to go step by step, like it doesn't show different steps following each other. You can, in the poster, you can generate a timeline or show different parts of the process. Okay? But in the infographic, then you can do this. They may look similar. They may do or offer similar ideas or benefits, but it is a little bit different. But again, the difference is very in the gray area, so I cannot say it for sure. If someone else have an answer and you call yourself an expert and you still don't know, you want me to understand it, it's not really easy. And I want to ask you a question now, because this is related to Dr. Bassim's question. When you said that you started to use Canva at experience level, can you answer to Bassim's question? How long did it take you to get to that confident level, or the level that you think that I'm really confident to start use Canva or any equivalent or similar website?
Within a few minutes, or maximum within 1 hour, I think I get all experience about its feature and the tools, and it was amazing. I was asked to build up a poster for a symposium in my faculty, and all the time I have a difficulty with Photoshop and other design application. It need more experience and complicated. But when I started to use Canva, it was a piece of cake. I can imagine how my
Initially, did you
productivity.
start with the free version or the paid subscription?
The web,
I mean
the web.
that experience level. Did you manage to achieve or get close to that with only using the free version, or did you need the paid subscription
Yes,
to get
yes.
there?
No, I didn't use the paid subscription. I always used the free, and I see it is enough. I didn't miss any option I needed in my design.
And this is exactly my idea here, that for beginners and even for at some level for experienced person, the free version offers a
No,
lot.
no, and yes, and all my students when use in their project, they only use the free version with no issue or complication. Any
Thank you
complaint
guys for
about it.
this. Thank you. Thank you so much for this discussion. And I believe you are going to bring this out in the end of the session while we are discussing, because this is a very important point that we are going to discuss in guidelines for using applications. Meanwhile, we are going to take the last question from Noon, and then I'm going to tell you the difference between infographic and poster. Noon.
Okay, hello, how are you all? Hope you're good. Thank you very much, Dr. Ahmed, for the nice presentation. I had a question, but you answered. But I just want to take the chance to say I'm very happy and thank you for your presentation. Very informative. And I like the part where you showed us the practical way of doing things. This was very informative. Thank you, Dr. Ahmed. It has
Thank
no
you.
relation with that gun you raised our face.
Thank you. Thank you so much, Noon, for the clarification. And I would like to add that this is actually correct. Dr. Ahmed gave you in a nutshell the important things. And I like the slide where he talked about how to make sure that it's simple, it's to the point, you have to revise it, because this is actually what is needed in order to do the infograph. In order to do it, this is a very nice, very informative slide. Now, regarding the difference between the infographic and the poster is something that you are going to put many information to attract attention. The aim is that it's going to be used for academic conference, public campaigns, whatever. The infographic, it is, let me quote Dr. Ahmed sentence, step by step. So you have something that is sequential. This is something number one, a lot of data, and it's a complex one that you need to present in a clear visual format. So if you have a very complex data and you need in a very short time to convey your message, you're going to do an infograph. And there are different things, by the way, that can be used to do the infograph. Canva is one of them. And the free subscription is different from the paid one with the different things. And you have just seen the benefits of the paid one with Dr. Ahmed. Do you know any apps also that can do the infographic? The PowerPoint presentation has infograph. Did you try it? Are you aware that the PowerPoint has infographic?
Yes, but I don't think that it is as easy as Canva or Napkin.
I utilized both. I think everyone has its own uses. Canva with much more ads points, because when you pay, you definitely are going to have much more service.
I had like the paid subscription from the beginning, so
Yeah.
I only used the free version for 1 or 2 days. And once I thought that, oh, I will need this for the coming years, I will really benefit from it. Then I started the paid subscription. But
Yes, sure. There is no contradictory here. The aim is that we have different apps. Everyone has the opportunity to choose whatever he or she feels that this is the correct one,
yes.
or he feels that this is. And this is where you can find, guys, the infographic. It's there, it's up when you go in to open it, and then you choose the themes. When you are going to choose these themes here, you are going to find infographic. As you can see, then you are going to have different types of infographic. You can choose whatever you would like to, and then start to edit and start working with that. This is a very simple, easy one. And there is the one that Dr. Ahmed utilized. And in every way that you are going to use it, either you're going to create a video or whatever, you need to refer to the slide that Dr. Ahmed has showed us, which is about what are the tips in order to create the infographic, because this is very, very, very important. Keeping concise, keeping simple, revising the information, making sure what exactly that you would like to use. The colors, this is very, very important when you are going to use that. Thank you so much, Dr. Ahmed. And let's move to our third presenter, Aula Azzat.
Good evening, everyone. I want to share my screen.
Good evening.
Is it shared now?
Yep, crystal clear.
Yes.
The floor is yours.
Okay. I want to start by introducing two main applications that is used for smart teaching and fun learning. I use it personally. I use it to engage students actively for better learning outcomes and explore many features of these two applications, which is Slido and Edpuzzle. Any challenges that we had should create from our educator personality a way out to use new tools, because we actually have a problem with passive learning, because traditional lectures are not interesting anymore in most of the for this new generation of young doctors. Also, we know that we have short attention span, from 10 to 11, 12 to 15 minutes before losing interest. So we need to actively recall information from the students now and then to keep it interactive. Sessions. So I'm going to introduce very simple tools that I use it personally, and I found them very simple and easy to follow, even with no difficult learning curve. The first one is Edpuzzle, which is a platform to create interactive videos with embedded questions to engage the learner. I found it enhance critical thinking, suitable for distance learning, perfect. You can give instant feedback to your students to learn, and it is adapted for different learning style, because some of our students can learn from the first time, others need to replay these videos and learn more. It has many benefits when using with different styles of the students. Also, gamifications, I found it motivates the students more to engage and foster a very healthy competition between the students, and enhance critical thinking. Uh, but I also, there is different gamification tools that I found during the search, like those you can see in the slide. However, I'm going to stress on Slido because it's really easy, and it can be easily integrated in our daily PowerPoint presentations. Let's go to for Edpuzzle demo. How are you going to use Edpuzzle? Actually, you are going to make an account in edpuzzle.com, and then you upload a video, add questions as you need at any time of the video, and then you can set the time or deadlines for tracking this assignment for your students, and the answers can appear easily, and track the progress of your students. Let's navigate the site. As we go to the site, you can see that it is edpuzzle.com. You can go and create your account simply, or you just join with your Google account. Hopefully it will open easily. Yes. As you can see, the platform is easy to follow. This is a demonstrating video inside the platform, where there is a video uploaded. As you can see, there you can stop the video at any time, full screen, speed up the video, and at the same time you can insert a pop-up question like this, multiple choice question. For example, you can add the answer, you can skip and go, or you can modify the options, so the student cannot skip the video unless they answer the question. He can rewatch, and then or submit the answer, and immediate feedback will appear for the students. If their answer is true, you can add feedback. As you can see, there is an option that you can edit this video at any time. As you can see, when you click edit, you can see all questions that you have inserted. You can also insert notes, multiple choice questions, or short answer questions, or open-ended question. All of them, when you navigate these questions, you can see that you can change or edit or change your feedback. That is very simple and user familiar. Once you finish, you can share a preview to your colleagues or to your students. You can assign, as you can see, assign for certain students this activity, and you can keep it public. For adding a new, this is the option, add new, and you can upload the YouTube video from any recorded video from your computer. As you can see, this is my account, and I use it in a project with my students. And there is a lot of interactive virtual patient cases. Each of them you can open and assign as students. You can see out or track the students who answered, and you can assign more students. As you can see, it is easy. You can use it in different modes. And actually, because I use this project, I get a Pro for my school, a Pro account that anyone from my school can use it open, because it is limited, but it's up to 48 videos or 50 videos you can use. As well, you can see in this option, professional mode, you can create your own course with different video like this. This is a professional open source video for 8Puzzle beginner. You can see 8 videos, and it is like an online course. So by this tool, you can create an online course. You can assign your students an interactive videos. And this is seems to be very interesting tool to me and user family. For using 8Puzzle, what do you think rank these benefits of using 8Puzzle from your point of view? Can you see the QR code? Would you kindly scan the QR code and start answering? Okay. That's perfect. You can see the answers that you already putting in this active pool with different rating, changing immediately and instantly. And actually, this slide is embedded in my slide smoothly using the next gamification tool that I'm going to tell you about. It is Slido, slido.com. You can use this tool, as you can see, to engage a student in your presentation immediately and they can see the results of their active poll instantly. They don't have to go to another website to use it. And this is Slido. Slido has many options. I want to share it with you. Slido, as you can see, it is embedded in my presentation. Once you go and download or Slido, it is embedded in PowerPoint presentation simply as a button. And in the sidebar, you can see many options with Slido. You can generate polls from the slides, by the way. AI tool that can generate a poll and suggest questions to use it in your presentation. It can give an audience question and answer slide. It can create quiz. You can use a word cloud, multiple choice questions, open text, and once you use it, it embedded immediately in your slide, like this option. As you can see, the slide that we navigate now, it appears like this. It is embedded, and you can edit, add more interaction with Slido using this only button and the sidebar that appears in the PowerPoint. So I found it very easy to use. Finally, I can tell you from a simple literature review that using these interactive tools showed that at different medical schools showed a 40% increase in student engagement, especially using 8Puzzle, 25% improvement in the exam scores via gamification learning or tools, 20% reduction in the lecture time and with these interactive videos and gamification tools. So it is evidence-based that these tools can improve your medical education teaching. However, it is time to go to the ground and play with these interactive tools. My call of action for you to transfer your teaching today is to try Edpuzzle and Slido. It is very simple and user familiar. Explore different gamification tools. Join the community that share experience about using these tools to know more about it. And there is many free trials available that you can use it simply and make use it. For example, Slido, you can use up to 3 polls or questions or whatever in each presentation, and it is I think it is enough. However, for best practice, please, with these tools, you have to align it with the goals. It is not just a question or just interaction for fun. You can use it and align it with the goals of the lecture. For using these tools, please make it clear instructions in the use, because not to waste the student's time in exploring how to use it. You can start small. You don't need to burden your teaching activities or slides with different feedbacks and tools. 1 or 2, 3 maximum is enough in each presentation. Engage students with fun activities. Yeah, you can use it. You can achieve your goals, but still be fun. How do you rate this session? And this is another option in Slido. You can use it for rating and to take a feedback by the end of session. Thank you. Thank you very much who attended. And the records, by the way, for any slide and for any Slido questions, it is kept in the slide, and you can analyze the results later. It is embedded in your presentation forever. So you can revise the feedback after the session as the time that's suitable for you. And you can see the number of the active participants who participated. It is written in the upper right part of the slide. Thank you for listening. I just want to add that this presentation outline is made by Gamma, which is another tool, AI powered, that make our life easy, and you should also explore. Thank you.
Thank you, Dr. Ola. It is an amazing presentation as usual.
Thank you, Doctor.
The nice thing in the 3 presentations till now is that they provide applications to be used. This is the idea of this session today, is to introduce some sort of innovations and also to provide applications to be used. Very good presentations. Personally, I will try Slido.
Thank you.
I like to use Quiz. Quiz has now facilitated by artificial intelligence, so you could upload a PDF for lecture, for example, and they create MCQ question with distractors and even feedback for each question. So also Quiz, I tried it and it is very useful. Slido and Edpuzzle also very good tools. Personally, I will try them.
Thank you.
Thank you, Dr. Aula, for your perfect presentations. And if there is any questions, please raise your hand and go on. A lot of comments, a lot of positive comments for your presentation, Dr. Aula.
Thank you, Doctor. Thank you all.
Dr. Farman, you could ask your comment.
Thank you, sir. Thank you very much. Thank you, Doctor. A very nice presentation.
Thank
you. Really, it's something new we are learning from you. I want to ask: is this like some parts of like Canva? They ask if you want to exceed or more use tools, they ask for subscription. So is it free or some parts they need subscription as well?
For
Thank you.
Edpuzzle or what?
Yes, this one.
Yes, it is. I used it up to 50 assignments, and it is limit for free subscription. But take care that when you subscribe for Edpuzzle or you create your account, make it I am a teacher when you choose the options during the account creation. Choose that you are a teacher in a school, because they track teachers in schools and they try to improve their experience. And I said they contact me personally when think that I am using Edpuzzle for my school for very different tools. They contacted me and they make my account approved for my school, for all my school, because I use it. So that they are tracking and they have monitoring system for this, but choose to be a teacher. But I think it is enough for daily presentation or your yearly presentation. It is enough to use the free
Thank you,
account.
Dr. Allah. Thank you.
We have two raised hands. Dr. Sumitri.
Good evening, everybody.
Thank
Dr.
you.
Ola, very wonderful presentation.
Thank
I'm
you.
always, it's always been great to see you present anything, and I've already appreciated you.
Thank you.
Actually, after going back from Famor, Slido is something that I have tried to use, and I could use 3 questions for free. I mean, in my PowerPoint presentation, I understood that the students were actually more engaged, and they were participating very well. But I would also like to use the Edpuzzle that you have shown. And one more thing I wanted to add is like how the Chat GPT is actually popping up in our PowerPoints these days. I think Slido also can be added to it, and we can actually use it directly from our PowerPoint presentations as well.
Yes, you can.
Yes. Yes. So I just wanted to add that point also.
Thank you.
Yeah. Thank you.
A question from Dr. Bassem, then Dr. Gamal.
Assalamu alaikum, Dr. Ola. Thank you for nice presentation.
Thank
you
you.
are shining as always.
Thank you.
I have a couple of comments and questions. What make Edpuzzle unique other than other competitors? I like it, and I like how you sell it. I'm buying it from you, and I like the way you integrated Edpuzzle with Slido and Gamma. So you have a confidence and working with harmony between the tools. I like this one. The other comment is, I see you give us a lot of statistics, which is nice. So you know the number of how much assignment you can do, how many candidates, which is great. But do you know, is there a time limit or no? Because some tools I used before, after I did the work, I discovered that there is a limit, and after this, everything will vanish. You know what I mean? So is there any time limit, and they will stop your access, or they ask you for paid subscription or not? Thank you.
Thank you. Okay, for the first question, I forget the first question. The first one about using Edpuzzle, is it going to change the subscription or finish? Actually, it is not. The opposite happen. When I finish my subscription, when I finish my limit in the subscription, or not in the subscription, in the assignment limit for students, they actually give me a Pro account to enhance all my colleagues in the college to use it. By the way, it is a Spanish platform, and it opens in different communities, but mainly it was for school teachers, and they are interesting in using or different applications in medical professional. from personal communication with them. Sorry, can you remind me with the first question?
Yeah, the first question about the uniqueness. Have you tried other tools?
Yes,
And
very important questions because you know, my project in FEMAR was about creating virtual cases and engaging the students to create their own cases, not me. Because when I tried many platforms to apply my project, one of them, it is H5P. It can create interactive, but this is for medical educators and the students, they have an access for it. I found it very difficult to interact with H5P with different options and meticulous options. Edpuzzle is very user familiar. All of my students, 100% of them, I'm not going to say learning curve or whatever, they all know how to use it. And they created all of them created their cases with simple options and simple interaction and feedback, and they added all of the options used by the students, indicating that it is very user familiar. It doesn't need sophisticated learning curve to reach. Yeah, this is
nice. Just last comment. I'm sorry, I'm taking more than I should. Where I work, we're paying a lot of attention to the confidentiality and psychological safety of the learners. So as you mentioned, they are tracking you, and this is why I give you the pro. But just I'm acting as a devil advocate. So I think if you engage any of your learners, you need to take kind of informed consent or give them heads up that there will be data collected, and they aware about this. The other thing is you are using the questions integrated into the lecture or the presentation. Would this be a formative or summative assessment? I mean, the questions during the presentation would be counted the result at the end, or will be the test at the end? Final comment.
If I give it an assignment, the results will be collected in my platform. I can create a playlist of assignment, and I can create a student project. This is an option. If you want to track and make it a closed project, you can make a student project with a closed workspace, like assignments in LMS, with tracking the students' grades and how they interact with each assignment. For my assignment, I didn't need to do this because I already make them. By the way, Edpuzzle is very good because when you create a link for a interactive video, it has an option to integrate in your LMS and Google Classroom and Microsoft Team. So it is integrated in every platform that you can use it. And finally, all my cases with the interaction, it's like a link. I can make a list of links for each case, and anyone can easily access even if they don't have an account in the Edpuzzle.
Okay. Nice. Last tip regarding the scanning the QR code. I wanted to give you a thumbs up, but I'm using my mobile, so I wasn't able to scan the QR code. Would you mind when you put the QR code to put a link beside it? So
yes,
if someone is using the mobile, so can use, because I wanted to give you thumbs up, but I wasn't able to do. I'm sorry.
Always put the link in the chat box, in the chatting. Yeah. This is very important for the mobile users.
Thank you. Thank you.
Dr. Gamal.
Thank you, Dr. Ola. I always learn it from you. And as you mentioned soon, really Edpuzzle is an easy alternative to H5P. So if you don't have an LMS platform, will be very useful for all users. My question about your experience on decreasing the time of lecture using gamification. You mentioned a statistical about it actually decreased the time of lecture, but the fact we used to integrate the gamification in our traditional lecture, so it will make the time of lecture will be more longer. What is your advice about using these tools to actually decrease the time of lecture.
This
to
is
be
the
more
first.
efficient.
Yes, if you remember in the slides, I said in the first best practice is to align with your goals. If you add your gamification tool or slides as for fun or to break the ice or whatever, just for this, it will make the lecture longer. However, if you design the gamification questions and the activities inside the lecture to align with the goal, you actually achieve the goal, and at the same time you decrease the length of the lecture, because if you find that this part of the lecture you achieve the goal by answering the questions, it no need to re-explain or repeat many things in the lecture. I think this is why it could decrease the time of the lecture. Yeah.
Thank you so much.
Thank you, Dr. Ola.
Ola, and I would like to raise something here very important. There is a difference between game-based learning and gamification. Game-based learning is where you just insert the game for the aim of ice breaking and in order to make sure that the students are engaged. Gamification, when you put science into game in order to make sure that they understand, engage, and also minimize the time that the concept may need in a fun way. So there is a difference. And when you do gamification, there is definitely engagement. There is knowledge retention, information retention, as well as decreasing of the time, if it was done properly. And I just need to echo what Dr. Ola said, because this is the key. You need to align what you are doing with your own goal. It's not the aim that I'm introducing so much in my place. The aim simply is that it needs to align with what I'm doing. The student can go out of the lecture saying, oh, wow, that was magnificent. Okay, what was the lecture about? I don't recall, but it was fun. Then you need to make sure to understand that you made a big failure. You use technology to enhance your objective. When the student comes out and say, oh my God, I understand that point. It was simple, easy. When we did X or Y, I understood that point. Then you succeeded.
Sure.
So it's a tool to facilitate, not to overwhelm your students. And this is something that's going to come in the tips and tricks and in the guidelines that you are going to use and utilize.
One of my practices about gamifications, that you could record short videos for multiple lectures for 30 minutes per lectures. You could record 2 or 3 lectures. Then during the in-class activities and face-to-face activities, design a game to overview and review the concepts and the scientific content of these 3 lectures. Within less than 1 hour, you could achieve this goal. So you could preserve the precious time of face-to-face for more clarifications and the application of the knowledge the student gained through the recorded lectures before the in-class activities.
And something also very important, a question that had been raised, which type of application to be used? Guys, the aim of these sessions, my dear fellows, is to enhance our community of practice and to exchange information. No size fits all. And the aim is that you are exposed to a lot of applications, that it changes on a daily basis. For an example, when I started to use Kahoot something like 6 or 7 years ago, it was something like 1,000 students were free, and you have this unlimited number of slides that you can do. Then after COVID, it came to be 50 students, and nowadays it's something like 10. So this is a change. Also, the Mentimeter was something that is open with 2 or 3 slides. Now the number decreased into something like 100 with 3 slides free per 3 slides subsequent, I think, or 2 per 1 presentation, and you have an overall something like 3 trials or something per month. So this is a change. Also, Poll Everywhere, it changes. So the aim of meetings like this is that you are updating yourself. What else is there on the scene? What I can use, what I may not, but no size fits all. Okay. And in order, Thank you so much, Dr. Ola, for the nice presentation and for this engaging discussion. Thank you, my dear fellows. But we have to go to our last presentation in order not to make our schedule on time. Muhammad Hassan, and from Zoom fatigue to Zoom fluency.
Dr. Muhammad Hassan, you hear me?
Yes, I can hear you, Dr. Hani.
Okay, you could share your screen. This is an interesting topic in order to break the burnout, Zoom burnout. It's an important topic, Dr. Muhammad.
Yeah, can I share
The
my
floor
screen?
is yours. Yes, yes.
Yeah. Thank you. Can you see my screen now?
Yes, yes, Dr. Muhammad. Yes.
Okay.
Go on.
Yeah. Zoom fatigue understanding and combating virtual exhaustion. One second. So I will talk today about Zoom fatigue understanding and combating virtual exhaustion. I think I did mild modification on the title on sake of the time because I found the original title. So Dr. Hani, can I just stop sharing and do sharing again?
Okay, okay, Dr. Hamsan. The floor is yours.
Yes, thank you very much. Yes, let's start. I will talk today about Zoom fatigue, understanding and combating virtual exhaustion. I did mild modification on the title in sake of the time because I found the original title, it will take long time or it need more than one lecture. So let's start with debate. So before I begin, I'd like to know what's your opinion. Do you think virtual meeting or face-to-face meeting are more effective in medical education? Please open your mic or write down on the chat box what's your opinion. Hello? Can anyone share thoughts?
Yes, if you allow me.
Yes, please.
Okay. For me, I think the face-to-face meeting is more effective because for the online meeting, there's always a warning behind the time, and everyone is expanding on their speech. So for me, it's face-to-face much better than the online, but it's not available at all the time. That's why.
Fantastic. Any other thoughts
A lot of thoughts, Dr. Muhammad, in chatting.
in chatting? I
All all agree about face to face.
Yeah. So in this lecture, I'm trying to change the thoughts. However, I prefer the face-to-face as well. But I prepared this presentation to try to change the mind of that. So I said that our objective is first, you can see my objective to this lecture today. So back to the debate, with the shift to virtual interaction, traditional face-to-face meeting have largely been replaced by Zoom and other video conferencing platform. While this change offer benefit like elimination, commute times, many individuals find virtual meeting more draining than those held in person. Concerned about on-camera appearance and the potential technical issue can add to the stress. Moreover, the constant screen time has left people feeling mentally and physically exhausted, giving rise to term Zoom fatigue. COVID-19 pandemic reshaped the landscape of medical education. Billions of worldwide shifted to computer-mediated interaction during COVID-19. Video conferencing adoption increased significantly since 2020 with over 300 million daily virtual meeting participants. Since 2020, video conferencing has seen dramatic rise. However, the extended hours spent on platforms like Zoom come with unseen cost leading fatigue and frustration. In this discussion, we'll examine the underlying causes, what now known Zoom fatigue, with platform becoming so widely used. Zooming has even turned in generic verb, reflecting the scale of daily virtual interactive. So what is the Zoom fatigue? We can describe as combination of psychological and physical strains, feeling of anxiety and tiredness, mentally demanding interactions. Stanford researcher found Zoom fatigue has 5 dimensions: general, social, emotional, visual, and motivational fatigue. Zoom fatigue takes a cognitive toll because the brain must work harder during video calls to concentrate on the discussion and interpret both verbal and non-verbal cues. This highlights demand increases cognitive load as virtual interactions require more mental energy and effort. Imagine having to constantly see yourself not just for an hour or two, but even for just 30 minutes while giving a lecture. How would that make you feel? Researchers have identified the mirror effect where continuous self-view during video calls can lead highlight anxiety, stress, and the negative emotional response. Visual overload, you can see the distraction compete for attention. Other people faces, background, personal details add to cognitive load. Excessive eye contact, unnatural eye contact, simultaneously viewing everyone, looking to everyone simultaneously, which is unusual. Listener to speaker are treated like speaker required constant attention. Reduce the mobility, like restriction movement during video calls. It is unlike in-person meeting. Fixed camera viewing, it's fixed camera field of view limits natural body language. If you're doing a phone call, it's much better than the video call because it is a great mobility and flexibility. So the physical and mental health impact. Zoom fatigue can harm yourself, can harm your health, reduce performance and mental health challenges. So it can reduce performance, compromise your health and the mental health as well. After discussing these challenges, it is important to look ahead. Video conferencing will remain a key part of communication and medical education. You have to think about FEMUR fellowship with a candidate from multiple countries. How could it function without Zoom meeting? Therefore, it is essential to develop effective coping strategies and continue researching both positive and the negative impact of virtual interactions. Now, let's move on to how we can tackle Zoom fatigue. And after several days of exploring this topic, I discovered 7 practical tips to reduce its impact and deliver more engaging virtual presentations to your audience. First tip is introduce yourself. One of the many challenges of remote work is the loss of everyday interactions that help build personal connection, whether you are speaking to co-workers or a virtual audience of unfamiliar faces. Take a moment to share something about yourself. If the group is small enough, you can also invite participants to briefly introduce themselves. Tip 2. Start with icebreaker. Engage your audience right from the start by incorporating interactive elements such as questions or games. This can boost the participation by up 40% within the first 5 minutes. Tell stories. During the meeting, many Zoom meeting can feel dry, so spice them up by sharing fun, relevant stories. Not only does this make your presentation more engaging, but it also makes you significantly more memorable, about 22 times regarding the research. Plus, it increases your likability as people connect better with your message. However, make sure your stories have clear point and align with key message. Keep them concise, ideal under 5 minutes before presenting. Rehearse your stories aloud, paying attention to tone, emphasize to make them more impactful. Tip 3. Use visual aids to enhance retention. Incorporate clear and relevant image or videos to support your point. This helps make your message more memorable. In virtual presentation, one key element that often missing is body language, like your position, eye contact, physical movement, which usually complement your speech in a live setting. Without this social cues in a virtual environment, the audience has to focus even more on listening, contributing Zoom fatigue. To address this, make sure to vary your vocal inflection to assist the comprehension of your message. Let's move to tip 4. Encourage active participation. Every presenter aims to maintain audience engagement and capture their attention. If you have previously presented in person, you are likely to familiar with engaging techniques like encouraging the audience to stand, ask a question, raise their hand, or even choose someone for pop quiz. However, when presenting virtually, don't lose that level of interaction. Encourage your audience to participate by typing a question in the chat, raising a virtual hand, or even calling an individual directly. Tip 5. Take frequent breaks and encourage movement. While there is some debate about the average human attention span, it is generally considered to be less than 20 minutes. For meetings that run longer than this, schedule brief breaks so participants can refresh, whether it's grabbing a drink or doing a quick physical activity like jumping. Physical movement is an excellent way to stimulate the brain, so encourage all your audience to stay active during these breaks. These breaks also give you a chance to brief recap the main point discussed so far, ensuring everyone is aligned and engaged. Tip 6. Use a different presentation styles. Vary your approach by alternating between lecture, demonstration, interactive groups activity like breakout rooms to keep things dynamics and avoid monotony. Use short videos or guest speaker can also add interest engagement. And you can select a presenter view. This setting helps eliminate on-screen distraction, allowing participants to focus better on you. Many people get distracted by their own image, so consider hiding your video feed to stay more focused on the presentation. Fewer distraction will help you and your audience feeling less fatigue and reduce the Zoom fatigue as well. Limit meeting lengths. Try to keep meeting under 50 minutes to ensure participants have time for their next commitment and they can stay engaged. If you are in the position to implement this policy across your organization, it will help people prepare for the next meeting more effectively. The last step, end with clear action plan, summarizes key takeaway and outlines the next step for your audience to ensure they know what to do moving forward. This is a short video, provide a brief explanation, Zoom fatigue, and offer strategies to combat it.
Imagine you're at a park, talking with your friend. Do you spend the entire conversation staring into each other's eyes? Probably not. You look around. You watch a kid kick a soccer ball. You comment on the clouds, and there are natural pauses in the conversation. You communicate not only with your words, but also with body language. Now, imagine having a video call with that same friend. Looking away from the screen now feels rude, so you end up trying to make eye contact for the entire time. You try to read your friend's body language, but now it's much harder through the screen. When the call finally ends, you end up feeling tired and drained. What you're experiencing is called Zoom fatigue, named after the Zoom video conferencing app. It's actually a pretty common problem. So what can you do about it? Well, let's say you have a work call coming up. A few minutes before the call starts, get up and walk away from your computer. It doesn't much matter what you do. What's important is to give your body a chance to move and your brain a chance to reset and prepare for the call. It's also important to limit any distractions. Find a quiet place to make the call. Close out of any unnecessary windows on your computer. Switch from grid view to speaker view. This will help to minimize the distractions on the screen. If you're joining the call from your home, you might not want people seeing your house. There are digital tools that let you blur or replace your background. Doing so could also help others focus more on what you're saying, since they won't be distracted by what's behind you. Being on camera can be stressful, so if you're allowed to, consider turning your camera off when you're not talking. Some apps will also allow you to hide your self view. That way people can still see you, but you can't see yourself. This might reduce any anxiety that comes with feeling like you have to perform. But remember, if you use this feature, the camera is still on, so don't do anything that might embarrass you. Following these tips will help you deal with Zoom fatigue. Of course, another solution is to just do fewer video calls. After all, an old-fashioned phone call still works.
GCF Global, creating opportunities for a better life.
Conclusion: if you have the experience of Zoom fatigue, you are not alone. As presenter, it can feel daunting to capture and maintain your audience attention while motivating them to take action. However, by implementing these steps, you will see noticeable increase of engagement. Consider recording your presentation and reviewing them afterward. Reflect on how you can improve. Are you emphasizing the key point at the right moment? Also, seek feedback from your audience. Did they feel engaged? Did they receive the right message? And were they able to take something actionable away? While much of your content may remain the same, the shift from live to virtual presentation can significantly affect how your message is received. Additional resources and videos about how to Zoom breakout rooms, whiteboard, and polls, it can in this presentation. I will leave it on the group and you can access to this links. Thank you very much. I appreciate your time and attention today. Please feel free to reach out with any follow-up questions. Thank you.
Thank you, Dr. Mohammed.
Thank you so much. That was very interesting, demanding, specifically that you are in a Zoom meeting. So let's start with the questions. Dr. Bassem.
Thank you, Mohammed. MashaAllah, I like the topic. I like it very much. I believe it should be a mandatory task now to learn the etiquette of virtual meetings or virtual conferencing now. How to humanize face to screen now is a bit difficult. To keep that eye contact without intimidating the person in front of you, to make it more human, to react. I feel that we need to exert more effort on our other body language because we have a limited access. If you are facing one person, they can feel your tone, they can feel your energy. You see the whole body rather than half body or even less on the Zoom meeting. My question for you, when you give us the statistics and numbers and things like this, do you think it differs from culture to another? Like in the Middle East, it's a bit different, or we have our uniqueness here. This is one thing. The other thing is, when you to start sorting any problem, we need to highlight there's a problem, which we call it create sense of urgency, which I got from you. Thank you for this. Have you tried yourself to use these tips? I felt you are a bit monotonous at some stage. I was enthusiastic about the topic, but I think taking the tips in consideration will take some time to apply. I think this is my comment. Thank you.
I think it's easy once you put that in your mind because I'm utilizing that in a lot of my meetings.
Yeah, exactly what I'm saying. This is what I'm saying. When we share our stories together, that I'm facing this problem and you are not alone. So this anxiety or stress or having difficulty is not for you only. It's everyone facing the same problem. Now we start to humanize it or feeling it. You are not alone.
Yes, and the problem is that the attention span during an ordinary lecture could last up to 12 to 14 minutes. And this time decrease in the online digital format because there is no sufficient time to maintain the concentration, and this is evidence-based. So you need to interact between now and then to maintain the focus of the people who are watching, just using whatever the interactive tool that you would like to use or whatever in order to make sure that you're following. And I like all the tips because actually in some places I'm utilizing this. We have to open the camera, you have to follow. We are using the reactions. We are having the breakout room. We don't do 1 hour without polls and breakout rooms because this makes the people engaging with you. And this makes people humanize the session, as you said, Dr. Bassem. Okay, any other questions to Dr. Mohammed?
I have one objection more on one of the tips where you said to engage them by pointing question to some party or some person. Actually, I feel this, and this some studies saying this bit intimidating when you put someone on the focus. Rather than this, alternatively, you can say, whoever answered the question will take 5 marks, for example. So it's kind of another way of making people engaged without intimidating or making them afraid that everyone will see them. You know, that one of the most rated fears is speaking in public.
That's
so
true.
Rather than pointing, Ahmed or Muhammad answer this question. So what me? Yeah, no.
Yes, you don't need to put anyone under the light unless they are voluntary, would like to.
I think I can answer this question. I think if you start with your lecture with icebreaker and you break the ice between you and the candidate, I think it would be familiar if you point the question on some point to him.
That's true, but believe me, in the real world, you can do that because you know the people and there is a rapport between you and the people. In the online, this is one of the contraindication, even after ice breaking.
Yeah.
Okay, in order not to...
Thank you. So no one please don't call my name.
Dr. Hani, do you like to add something?
Yes, thank you all for this amazing interactive presentations with a lot of applications and softwares. Thank you for the fellows for engaging and interacting with the presenters. I think we all enjoyed this session today. Thank you all.
Okay, before we close, we are going to do a couple of things. The first one is general rules while using technology, where you need to select the right platform. You need to utilize interactive content, incorporate asynchronous and synchronous element, promote collaboration and communication, enhance engagement through multimedia, continuous feedback and assessment, personalize the training experience and the learning experience as much as you can, maintain academic integrity, stay updated and seek feedback, build and a supportive online community. And this is what we are having right now. And I believe some of these ground rules had been actually said by your colleagues. So the tips and tricks is that actually general tips, you need to have an active learning strategy. I need to have something that enhances their learning and to promote, to post the student engagement. You need to provide a technical support while you are utilizing technology with the students. So there are clear instruction, there are providing technical support, where you can go, whom you can go, and why you are going to do that. And then you have to always maintain a feedback and assessment, utilize whatever you are going to use in order to make sure that the students are assessing their learning outcome. And there is an interesting video that I'm going to post for you in the chat where you can check it later at your own free time, which is about technology enhanced learning. And this had been done by Hani something like 4 years ago when we have been talking about education and we have been talking about technology. I appreciate watching that. And now we reach to the end where we are going to expect you to write in the chat the takeaway message that you have received from this session and any questions that you would like to raise. So kindly post in the chat the takeaway home message. Okay. Okay, Dr. Emmanuel, send it to you to be sent to the WhatsApp group, and I'll appreciate the presenter to send their presentations to Shaima, and she's going to collect them and send all of them via email to all the fellows. Choose what meets your need. Perfect. Online teaching can be greatly enhanced if the right tools for the right objective had been excellent. Interactive tools, perfect. Yeah, explore, use, and tailor for your need. Zoom meeting is not a good way for learning. Okay. We should make effort to better educator. Yes, we indeed need to increase student interaction and engagement. We need to choose the tool we are using according to our objective. Interactive sessions can be done by additional objective. Perfect. We get a good attention span. That's correct. Active learning is rapidly evolving and we need to cope with it. Telehealth. Okay. This is interesting and excellent. We're still waiting for people to write. For those who had wrote, can you please insert in the chat one reaction or one emoji that reflects your emotional state regarding the session? Nice emojis. By the way, I use these emojis in the start by the breaking out in the session as an icebreaker by asking the students to insert 3 emojis that reflect their last week status. and students start to insert the emojis and start to explain their emojis. Okay, I didn't understand Basim one, and I didn't understand Ahmed Waili one. And Abir one. Why you are sad, Abir?
I was trying to think, but it failed.
And for me, I was paused and troubled by Dr. Basim's comments. So we had more than enough for him today.
Okay, that's true. That's true. And this is the aim of the Famer family and the community of practice, to engage, to exchange ideas. And Dr. Hani would like to sleep because he had a long day since the start of the day. Okay, excellent. And one of the nice things that we have also in Zoom is the reactions, guys, where you can start by saying to the people, we have thumbs up if you are agreeing with something. And if you disagree, you do this thumbs down. And if you love X or Y, and if you have a question, you may utilize. And people start to utilize that if they don't want to open the camera. And it's a very nice one, by the way. And by this, we reach to the end of our session today. Dr. Hani, do you would like to say something before we close the session?
Thank you, Dr. Nagwa, for this session. Thank you all. And I hope we meet soon in face-to-face sessions, not online sessions.
Thank you, everyone. This is one of the most engaging sessions where we learn from each other and we exchange ideas. So thank you for giving us and for giving your fellows this nice opportunity, and see you later.
Thank you, doctors.
You're welcome. Bye.
Thank you, Dr. Nagwa. And thank you, everyone.
You're welcome.